to go. I'd like to call to order the Stokes County Board of County Commissioners meeting for Monday, February 27th, 2023 at 2 p.m. Would we please start with the invocation, if you'd join me, please, if you desire. Our most gracious Heavenly Father, we thank you for the privilege of meeting here to do the county's business. We ask your strength and wisdom and guidance as we make decisions that affect the county. Please lead, guide, and direct us during the coming week. In your most gracious name we ask it. Amen. Amen. Next item is the Pledge of Allegiance. Please join us for the pledge. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please be seated. Okay, the next item on our agenda is approval of the agenda. Can I have a motion for approval of the agenda?
I make a motion we approve the agenda. There are any.
Have a motion and a second. All in favor say aye.
Aye.
Opposed, no. Okay, agenda is approved. Next item on our agenda is public comments, and we have several folks that are going to speak today. So we will start with Marcia Marshall.
I think on your public comment sheet, does it say on there that all those other folks are yielding time? For reasons.
Oh, yeah, several of them do. Yeah, so 1, 2, 3. 1, 2, 3, 4, 5, 6. All 7 of them are. So, okay. So what's that equal? 3 times 7?
It was 4 actually, now 4 minutes for public comments.
Oh,
But you have
yeah.
a 30-minute total limit. Do you want to set a 30-minute timer?
Just
in
do
that
the
way?
30 minutes. That's more than 30 minutes, I think. So just, yeah, we can do that.
Okay. Good afternoon. My name is Marcia Marshall, and I reside at 1055 Watt Stevens Road, Danbury, North Carolina, 27016. I come to you today as a 28-plus year Stokes County DSS employee, as well as a lifetime Stokes County citizen. I have worked the last several years as program manager supervising child welfare and adult services, and I will retire tomorrow with a little over 30 years of service. I envision my retirement to be filled with well wishes from friends, conversations with co-workers, and just spending time reflecting on the last 28 years of my life at DSS. But instead, my days at DSS ended last week with me only being allowed in the building to pack up my belongings under the supervision of the DSS administrative officer and the county's human resource director. I cannot even begin to express to you how this felt, having given so much of my life to this county. During my time at DSS, I have had the opportunity to work under 6 directors, and during this time, to my knowledge, I have had very few complaints about my work. I have received no written warnings or had any work improvement plans. My intent today is to share a little information about my recent experience with Stokes County DSS in hopes that changes will be made. I have dedicated my entire adult life to DSS and have always gone above and beyond to ensure a child was never left in an unsafe situation. This oftentimes took precious time away from my own family. During these years, I have basically been available 24/7 to DSS staff, foster parents, as well as families DSS was working with. I can't tell you how many times I have been called while on vacation or just off for a day, but I'm not complaining. I'm just trying to convey my commitment to my job. At the end of my speaking, you and many other Stokes County citizens may ask why I would be putting all this information out there for all to see and hear. And the truth is, I would rather not be here under these circumstances, but I have always stood up for what is right and advocated for social workers, and that is what I'm doing today. Many in this last election for county commissioner campaigned on their belief that there should be transparency here in Stokes County in every department, and let me just say, I wholeheartedly agree. It has literally broken my heart watching the Child Welfare Department deteriorate and at such a fast pace. I know in the past the Board of Commissioners have expressed interest in why so many people leave DSS, and this likely could be answered by reviewing exit interviews. While exit interviews are a great way to gather feedback from employees who are leaving, there doesn't seem to be a lot of questions asked during these interviews by HR, and they have never been shared with supervision. Workers recently have been asked very few questions, resulting in workers feeling the need to provide their feedback in writing. Recently, the director advised the Board of Commissioners that workers were leaving social work because they can't handle work balance family life. I can assure you this is not the case and is the furthest thing from the truth. She has also portrayed that recent turnover has been due to pay, and while pay is one of the reasons people leave, it is not the main reason. DSS has lost several employees this year who had planned to make their careers at DSS. Over the last year, workers have attempted multiple times to advocate their needs for appropriate and adequate supervision. Unfortunately, their complaints have fallen on deaf ears. Workers did not feel their many concerns were being addressed, but instead it became obvious the supervisors were being told exactly what the workers were saying, which then resulted in a more stressful work environment. To give you an example of what type of environment workers have been subjected to, I will provide you with a few examples. On one occasion, workers were referred to as unloyal bitches, and on another situation as petty ass bitches. These comments were made by a supervisor in the presence of social workers. Social workers should never be subject to this type of behavior by anyone, especially not by a supervisor at any time, yet they were. I listened to workers and advocated for the needed changes at DSS by discussing them with our director, but to be honest, her communication with me was and always has been almost non-existent. Turnover has always been a big concern for child welfare, particularly in the foster care unit. And if this type leadership continues, my fear is there will be no one left to protect and provide services to some of the most vulnerable people in our county, children. Throughout my years at DSS, I can honestly say I have always loved my job. Although child welfare jobs are mentally and emotionally stressful, it can also be very, very rewarding. Unfortunately, though, the bad days still outweigh the good. This is why child welfare must have appropriate support and supervision at all times. A lack of these two things creates more stress to an already extremely stressful job, which then results in turnover that could likely have been prevented. In order to explain why, where and why I think child welfare is now, I feel I must share some personal information. I will begin with the day of 9/8/22, the day I was placed on investigatory status with pay, pending an investigation of reports concerning unacceptable conduct, specifically breaching confidentiality. While on investigatory status, I was instructed to remain away from the DSS building until I was instructed to return. In addition, I was advised that I should not be in contact with any staff, DSS clients, foster parents, or adoptive parents. This prevented me from communicating with many of my friends who are social workers, foster parents, and adoptive parents. To be quite honest, this drastically affected my mental and emotional health, as I was forbidden to have any contact with much of my support system. Also, my daughter works for DSS, meaning I could not even communicate with her for fear of disciplinary action being taken against me for not abiding by my investigatory status restrictions. My understanding of my being placed on investigatory status is that there was an allegation made on 7/6/22 that I breached confidentiality by contacting my husband, Mike Marshall, who was and continues to be a sworn officer with the Stokes County Sheriff's Department, about an ongoing CPS case. My husband, as most of you know, worked in law enforcement for over 30 years here in Stokes County, the last of those as sheriff. It's safe to say he knows a lot of people, and I have no control over what people call and confide in him about. From the date of this CPS report on 3/2/22, the mother had been discussing her CPS case with my husband, but at no time did I share any details of this case with him. To be honest, he knew more about the ins and outs of this case than I did. It was known by the department, by myself, at the time the report was made that Mike knew the parent in this case and that the parent oftentimes talked to him as a friend. In reality, the mother offered Mike as a collateral, and by DSS policy, the social worker could and really should have contacted him to inquire about any concerns he might have about the mother or child. Just to be clear, I had only met the parent once in my life, and that was prior to her 13-year-old child in question even being born. I will admit that I did request that I not participate in child and family team meetings or telephone calls with the parent, as I thought it might be awkward and cause problems since the parent knew I was married to Mike. But I did participate in all staffings with social workers and supervisors up to the point of custody. On On one occasion, I was even called in the middle of the night by an on-call social worker and supervisor for advice as to how to handle a situation with this particular family. This supervisor later reported that this case was a conflict for me, but had no problem with calling me in the middle of the night when I was not on call. Just so you know, I never breached confidentiality, but even if I had, there are laws that allow confidentiality to be breached if a child is at risk of being harmed. Stokes DSS also has a court order with law enforcement that we are allowed to share information about cases involving children. Truth be known, had the director addressed this situation with me timely, this entire situation could have been resolved, and myself, as well as the Child Welfare Department, would not be where we are today. In order to better understand what occurred from 7/6/22 until my being placed on investigatory status on 9/8/22, I feel I must give you some further background information. On 7/6/22, DSS could not locate a child involved in an ongoing CPS case where the child was supposed to have returned home with his parent the previous day. The child was at no time supposed to be unsupervised with his parent, and there was information that the child was with the parent at the beach without an approved supervisor. Due to there being concerns for the child's safety, the two CPS supervisors and social worker wanted to file a petition with the court and assume non-secure custody. While there were concerns, DSS had no concrete information that the family was at the beach without an appropriate supervisor, and due to these concerns and knowing that the parent likely had contacted Mike, I called him and asked him if he had heard from the parent. He advised that the parent had been calling him, but that he had not answered her calls as he was working. At that time, I asked Mike to call her and tell her to bring her child home. I provided him with no details of what was going on with the case, and he didn't ask. I actually had Mike on speakerphone as there was a lot going on in the office, so other workers heard our entire conversation. It is not as if I was calling him secretly. During the time I was waiting to hear back from Mike, I had instructed the social worker and supervisors to continue making diligent efforts to obtain more necessary information regarding the safety of the child, as there were still a lot of unknowns about the child's whereabouts and his safety. I, as program manager, personally want as much information possible prior to assuming non-secure custody of any child, as taking custody of a child is almost always traumatic for all involved. These decisions should never be made hastily. It was obvious the two supervisors disagreed with my decision that further efforts needed to be made, but they did comply, and once the requested information was provided to me and it appeared that the child's safety was compromised, I agreed for DSS to file for custody of this child, and the judge granted DSS custody. On 7/6/22, after custody of the child was granted to DSS and I had left the office, a conversation between the director, two supervisors, and the DSS attorney occurred, at which time the attorney mentioned that the mother had said my husband was advising the mother. Once the director heard my husband's name, she asked the two supervisors why Mike was involved, at which time the supervisors portrayed that this case was a conflict case for me and that I should not have been making decisions. While my husband had indeed talked to this parent throughout the life of this case, he at no time advised her, but did many times recommend that she speak with her attorney. It was also stated that I had waited to hear back from Mike before making a decision about custody. This is totally false. At the time of custody, I had not even heard back from Mike as to whether he had gotten in touch with the parent. I actually didn't hear back from Mike before I left the office for the day. But let me be clear, regardless of who my husband knows or is friends with, that has never and would never affect the decisions I make while doing my job. Also, at no time did the director or any supervisor address any concerns with me about this case possibly being a conflict or the possibility that I had breached confidentiality. I can provide you with information about that if needed. On 7/7/22, I came to work not knowing anything about the meeting that had occurred the day before after this case had allegedly been a conflict for myself and that I had possibly breached confidentiality by calling my husband. I went home that day after working not knowing anything about any meeting, at which time my husband received a call from the parent advising him that the supervisor who came to the home the night before said that a complaint had been made to the director about myself. Having not known of any complaint, I immediately called the two supervisors inquiring about what had transpired the day of custody after I left the office. At that time, one of the supervisors advised me of the conversation between the director, two supervisors, and the attorney. The supervisors had been instructed by the director not to talk to me about what had been discussed, and while they did not talk to me, they did, however, speak with another social worker who at the time was supervised by myself and the 2 supervisors, giving her specific information of what had been discussed. If I'm not mistaken, this would have been considered a personnel issue and should have never been discussed with an employee, especially one supervised by the 2 supervisors and myself, yet it was. On 7/8/22, nothing was said to me by anyone, including the director, about a complaint or even a concern involving this case. That evening on Friday, after hours, the director called me out of the blue and advised me that she had no intentions of firing me. Imagine my surprise, as I had no idea of anything that I had done that could possibly result in my termination. The director advised that she would like to talk about things in person, and I stated that would be great. My husband at some point contacted the director to explain his involvement in this case and address the complaint against myself. The director then advised Mike that it really wasn't a complaint, but was just a concern, portraying it as no big deal. On 8/1/22, still not having any communication with the director about the possibility that this case had been a conflict for myself or about the possibility that I had breached confidentiality, out of total frustration, I emailed her with my intent to retire to 28/23. On 8/5, while the director was at the DSS Institute in Hickory with 2 supervisors, the 2 supervisors I have previously referred to, I received an email from the director stating that she was making a small organizational change and was moving supervision of the social work supervisors from me to her effective 8/8/22. While this may have been a small change to her, I assure you this was no small change for myself and the social workers. In all reality, this was a huge change. The director stated that the main reason she was making this change was so she could begin working with the supervisors and their teams. From 8/8/22, I was no longer to supervise any supervisors, social workers, participate in CPS and foster care staffings, court, meetings with the state, etc. I received no explanation why this abrupt and major change was occurring. I have never heard of anyone wishing to work closer with teams in a DSS agency and at the same time remove the person who likely has the most knowledge. I ask you, what sense does that make to disclude the program manager who has 28 years of experience? On 8/22, the director emailed me that she would like to meet at 1 o'clock that day, but I was off that morning and was not going to be able to make it in as planned. She advised that we would just meet the next day, but the next day came and went without a word from the director. On 8/10, I was asked to come to the director's office. This is the first communication I had with her concerning this CPS case in question and the changes in my job duties. I encouraged her to speak with workers about the changes she was making, as they too were going to be impacted by the changes, and they were expressing concerns. To my knowledge, this never occurred. Please make note that a month went by with no conversation with me about this case being a conflict or that I had possibly breached confidentiality. From 7/6 to 8/10, there was literally no discussion with me by the director about what had been alleged by the 2 supervisors. On 8/12, I emailed the director about my inability to provide supervision to workers, as it felt as if I was being disciplined for something, and to my knowledge, I had done nothing wrong to warrant this significant change. She assured me that that was not the case. I continued to encourage her to speak with staff. At this time, she was meeting with the 2 supervisors daily, but was having little to really no communication with me. Communication has been an issue at DSS for quite some time. On 8/15/22, I was asked to meet with the director and the 2 supervisors. This meeting appeared to be for myself and the supervisors to discuss what had occurred on 7/6/22 and work out our differences. To put it nicely, this meeting did not go well, as I made it clear that I wanted to move on and do my job, but that the friendships I had shared with the supervisors would no longer exist. My opinion was that the supervisors had misled the director and portrayed this situation in question as something it wasn't, and neither of them saw that as being a problem. While friendships are nice to have in the workplace, it is not a necessity, and in my opinion, we were all at DSS to do a job, and I was prepared to move forward doing my job. Sadly, I was never given the opportunity to continue doing my job while no longer sharing past friendships. On 8/18/22, I met with the director, who advised me that she had contacted the state and that my calling my husband was a big, big deal, and that she had to decide how to handle it. Unfortunately, the information provided to the state was inaccurate information. Had the state had all the accurate information instead of only information provided by the two supervisors, I feel certain the state would have felt differently about my decision-making concerning this particular CPS case. When asked if there was a possibility of me being terminated, she would not answer, but did state that it would result in a pre-disciplinary conference. She advised that this would occur the following week, as the next day was a Friday. On this same day, the foster care unit was emailed that for the time being, I was not providing supervision and that she would be working on some restructuring. They were advised that if they needed something and didn't have access to a supervisor, or the supervisor could not answer their question, they were to come see her or send her an email. It was clear she didn't want workers coming to me for anything, and I am still uncertain why. This was extremely frustrating for workers, as they oftentimes would seek guidance from a supervisor who was not familiar with particular child welfare policy or a case when I was on the hall and available to answer their questions. This oftentimes took away from doing their jobs, as they had to locate a supervisor or the director for guidance when I was there to offer guidance. Workers expressed their concerns to me as well as the director and continued to come to me with questions, but I always advised them to do what their supervisor told them to do, even if it wasn't the correct thing to do. On one occasion, a worker was in the office at 5 o'clock working on a case that was possibly going to result in DSS filing for custody. I was the only supervisor on the CPS hall, but due to my restrictions, I was unable to assist her and advised her she would need to contact a supervisor, and I hesitantly left the office. The changes in supervision resulted in many workers to begin searching for other employment opportunities. Workers didn't feel that decisions being made by the director were in their best interest or the best interest of the families DSS serves. On 8/19/22, not having been provided my new job duties, I requested that my previous supervision duties be restored. On 8/22, this request was denied, and the director advised that she was in the process of redefining my job duties and she would let me know when she was finished. From 8/8 to 9/2, I heard nothing concerning my job duties, what my job duties were, and I was not allowed to provide supervision or guidance to workers who oftentimes need daily guidance. This change affected the entire child welfare department, and to be honest, workers had no reason to interact with me, as they were not allowed to come to me with any questions. My days basically consisted of sitting in my office with very little to do, so mainly I read books from 8:30 to 5. I was basically completely isolated and would sit in my office listening to worker staff cases, as that is an ongoing occurrence, not being allowed to offer any advice. This made for a miserable environment for myself as well as other social workers. On 9/2, I received verbal notice of what my job duties would be, and that my office would likely be relocated. I have a copy of my new job duties as well as my original job description approved by the county for anyone who would like to see the significant difference. Due to my not agreeing with changes being made affecting the child welfare department and the concerns workers were voicing to me, I asked the DSS board if we could be heard about our concerns, and when this request was not acknowledged, on 8/2, I filed a grievance with the DSS board. On 9/7/22, I met with Shannon Shaver and Jamie Clark about our concerns and was advised to file a grievance with the Stokes County Board of Commissioners, which I did that day. The next day, on 9/8/22, I was asked by the director to turn over my work identification key and keys, and I was walked out of the building. The DSS board met on 9/15 in a special called meeting to discuss my grievance, and according to the board chair, Jan Spencer, after much deliberation, the board unanimously determined the board was not authorized by law to take any action, as my grievance was related to perceived personnel actions within the discretion of the DSS director. To my knowledge, my grievance filed with the Board of Commissioners was never formally addressed or discussed. Once receiving this letter from the DSS board, I was left with this still unanswered question. If the DSS board and the Board of Commissioners cannot address concerns DSS employees have with leadership, then who can? I followed all guidance I was given to address ongoing issues myself and other workers had at DSS and exhausted all avenues known to me. Once placed on investigatory status, I consulted with an employment lawyer who advised me to file a petition with the Administrative Office of Hearings. Unfortunately, I was advised by this office that placing someone on investigatory status is not considered disciplinary action, and since no disciplinary action had been taken by DSS against me, that the Administrative Office of Hearings had no jurisdiction to hear my petition. I have copies of those also. I also have documentation of ongoing concerns that have been provided to the director, the DSS board, and the Administrative Office of Hearing. Since being placed on investigatory status with pay on 9/8/22, to this date, I have been provided no information or findings from this investigation. I have asked for this numerous times, only to be told that DSS is not required to provide me this information, and they do not intend to provide me with any findings. I'm sorry, but should I not have the right to know what the investigation findings were, or could it be there was actually no evidence found because there never was any to begin with? Please make note that this placement on investigatory status occurred 2 months after it was alleged that I had breached confidentiality. My question is, why would one wait 2 months to investigate an allegation if it was such a concern that warranted placing me on investigatory status? Should this not have been addressed on 7/7/22, or at least soon after the allegation was made? On 9/26, my investigatory status with pay was continued for another 30 days. On 10/27, my investigatory status was again extended with pay, but this time allegedly due to facts arising that suggested that my return to the DSS would cause a disruption to the workplace. The letter I received also stated that it was DSS's understanding that I no longer felt I could safely return to work at DSS for the time leading up to my potential retirement date. In all honesty, there is no way I could have mentally or emotionally returned to DSS knowing the environment I would be forced to work in. Also, I had been informed that effective 9/8/22, the front desk staff had been advised that if myself or my husband entered the DSS building, that the director should be notified immediately. Really? Myself and my husband have never done anything to warrant this request, leaving me to wonder what DSS staff must think. I firmly believe my character has been damaged by the actions taken against me, and I have always taken pride in my work. How could anyone be expected to go back to a workplace when the obvious perception by coworkers would be that I had done something horrific enough to be placed on investigatory leave? I mean, what would you think? My status is to continue being reviewed every 30 days to determine whether the reason for an extension continues to exist. I was originally asked to agree to the continuation of my investigatory status as an accommodation, and that I agree to, number one, within 3 business days, provide a written, signed, and notarized statement that I would resign and seek retirement effective 2/28/23. Number 2, within 3 business days, I would dismiss my contested case that was pending before the Office of Administrative Hearings. Number 3, I would waive the right to file any additional grievances, complaints, suits, petitions, and/or reports with the Stokes County DSS Board, the Office of Administrative Hearings, the EEOC, or the courts regarding any of the facts that gave rise to this investigation status or extension thereof. I was instructed to remain away from social service building during this time and be available by phone, email, or in person if needed for necessary information. After consulting again with an attorney, I fulfilled my part of this agreement and signed the agreement that day and provided the original to Shannon Shaver, the county manager, as I had no desire to return to DSS. In my opinion, the actions taken against me by the DSS director was nothing less than personal and retaliatory. I gave 28 plus years to Stokes County and have never done anything but try to help families, protect children, and advocate for those who work beside me, who, like me, were trying to help families in crisis. Did I make mistakes in that 28 years? Absolutely. But I can tell you, I owned every one of them and usually admitted my mistakes before anyone even had a chance to complain. Like everyone else in this world, I am not perfect and have always viewed my mistakes as an opportunity to learn, grow, and hopefully not make the mistake again. Once entering this agreement with DSS, and since I was not actively working, I pursued an employment opportunity with the Stokes County Schools as a substitute teacher, working no more than 30 hours weekly. I was approved on 11/7 by the Stokes County Board of Education and met with administrative on 11/8 to complete my paperwork. Since then, I have worked almost every day allowed and have been contacted by several schools daily needing subs. On 11/21, I was advised by a school I was subbing for that she had received a call or an email from Melissa Jessup stating I had some missing paperwork and could no longer sub until the paperwork was completed. I contacted Melissa on this date but had to leave a message, but on 11/22 she returned my call and advised me that someone had contacted their office stating I was on administrative leave at DSS with pay, and this person had expressed concern about me subbing and being around kids due to my status with DSS. I immediately provided Melissa with information and paperwork concerning my leave, and it was approved again by the Board of Education, allowing me to resume subbing for Stokes County Schools. My question is, who had detailed information about my investigatory status, as this is personnel information? No one should have known the details that were reported to Melissa Jessup, except for the person who wrote the letter and Human Resources. I do find it ironic, though, that on the same day that a call was made to Melissa Jessup, around 8:00 a.m., I had run into one of the supervisor's children at the school I was subbing for, and the first call to Melissa Jessup was made that day before lunch. Coincidence, maybe, but not likely. On 11/25, I received a certified letter from DSS stating that my investigatory status would be extended for another 30 days with pay to avoid disruption in the workplace. This letter also stated that DSS had been informed on 11/9 that I was engaging in employment outside of DSS and that my employment had not been approved. Requests for approved secondary employment must be made to the DSS director. Due to my not having proper approval, I was advised to terminate any current secondary employment, and if I violated this policy, I would be subject to disciplinary action. I immediately prepared a letter requesting approval for me to work part-time with the Stokes County school system. Having not been aware that I had to obtain approval from my department head, I had only sent an email through Shannon Shaver in HR informing DSS that I was substitute teaching, but that I would continue to be available by phone, email, and in person. I confirmed with Shannon that Jamie Clark had forwarded the email to the director of DSS. Having already reviewed policies and procedures, I understood that my position with DSS took precedence over all other occupational interests. Since my being placed on investigatory status, I had not been contacted by anyone from DSS needing my assistance and did not foresee that changing. But as stated in policy and in the agreement I signed, I have continued to make myself available to DSS. I have not received any notification since 12/22 concerning my employment status with the county, thus I am uncertain if my investigatory status was continued until my retirement date, but I'm assuming that was just an oversight. I'm not sure if the people of Stokes County are aware, but Stokes County schools are in desperate need of substitutes. This position allows me to continue serving the county in which I have always lived and worked, and hopefully be an asset to this county in a different capacity. I'm not sure why DSS would attempt to prevent me from working a part-time job assisting our county when I was providing no services to DSS per our agreement. I would like to point out that from approximately 8/5, when my supervisory duties were removed, until 2/28, I have received full monthly salary payments from Stokes County for basically doing absolutely nothing. While I am satisfied with the agreement offered to and accepted by me, I am sure the citizens of Stokes County would prefer their tax dollars be spent on someone actually working.
You can go ahead and wrap up, Marcia. That's 30 minutes.
Okay. I actually did offer to work from home, reviewing cases and completing adoption assistance, basically what my new job duties were, to be effective 9/2/22, but was told that would not be needed. According to CPS workers still at DSS, cases are not appropriately being reviewed and they are receiving no feedback from supervisors. This feedback is crucial for workers, especially new workers, as workers often just miss required forms, information, etc. when completing a case. This is also an excellent opportunity to reflect on a worker's strengths and needs. So I can leave the last 3 pages for their review. And I actually have copies for everybody. Let me just give you that.
All right, just for the record, the other folks that signed up and yielded time to Marcia were Christina Fulk, Lauren Johnson, Cancy McKnight, Virginia Smith, Shannon Wall, Brittany Hall, Mike Marshall, and April Bullens. Okay, next item on our agenda is comments from the managers and commissioners, and we'll start with Commissioner Mendenhall.
Well, it is good to see everyone come out, and I appreciate everybody that's sitting here today. It shows me that you have an interest in not only the governmental process, but also what occurs in our realm of responsibilities. Means a lot to me. I think there was a key word mentioned in that sentence, and I certainly hope that it is carried out. That word's transparency. For anyone that doesn't know what transparency means, it means being out in the open with things and not hiding things behind closed doors. And I'm going to say this very frankly. It's my 7th year on the Board of County Commissioners. And if you think I barely got in, I've actually been the top vote getter both times I ran. So that tells me, I hope, that the people in Stokes County trust me and believe that I will do a job for them that they would be proud of. After 36 years in the school system as a teacher, counselor, coach, assistant principal, principal of 3 different schools, and superintendent for almost 5 years. My character was almost assassinated, along with my wife's, a couple of years ago by a group that didn't want to have me reelected, and they didn't want to have me reelected because they knew I was going to be open and honest. So I say to you, you want transparency, you better be pushing for transparency. I've never had one person call me and ask me a question that I didn't pursue and find the answer out for them. So, I thank you for being here today. For everybody that's on YouTube, I appreciate you. 45,000 strong in Stokes County. I'd say 44,000 of them know me. When your principal is Nancy Reynolds, Sandy Ridge, North Stokes High School, superintendent of the school system, you get to deal with thousands of people. And I say this, my belief is very firm. Our job is to serve the citizens of Stokes County. You're not supposed to serve us. We're supposed to serve you. And as it says, as we deal today and what's going on in America, when you hear people like Mark Levin and others, they say, we, the people. It's our job to serve you. And that's all I have, Mr. Chairman.
Thank you, Commissioner Mendenhall. Commissioner, thank you, Hamler.
In terms of transparency, I'm one of those commissioners that ran on transparency, and I'm 100% with transparency. But I try to also do actions, not just words. So far, in fact, we'll get to this later on our agenda, is I was one of the main components of my campaign in transparency was providing public records. Well, you'll see that I put that in action. We'll be voting on that a little bit later and read the policy. So I have no issue with supporting what was just given to us in the public comment section by Mrs. Marshall. My conflict is I come from a municipal government, so I'm real familiar with personnel laws when it comes to municipal employees. The part that I'm not real comfortable with because I didn't deal with it in day-to-day issue. When I worked with DSS in Cumberland, it was more of an administrative action, kind of like what Sheriff Marshall goes through in the sheriff's office, of dealing with the problems of where DSS needed our help or we needed DSS's help. So mutual cooperation. So the issue here is, well, there's 2 or 3 issues, but the first issue here is I got to make sure that statutorily that the Board of Commissioners have the legal right, the way the system is set up right now, that I can actually comment on it or to be able to legally hear both sides of the issue. Now, listening to one side of the issue, I'll be very honest with you. I've got some concerns and I would have some questions. But I don't think legally that the way it's set up in Stokes County, that I can do that. So, as much as I want to be transparent, I also don't want to be in violation of the state statute. And I know the state is very clear that, for most parts of DSS and the health department, they kick it down to the local authorities. But I've got to follow the way this was set up. And just to be clear, and this is because I just want to make sure that we're not rewriting history here, is that, I was sworn in on December 4th. And if I understood the dates, this has been going on for a while. And you had a previous board up here that I guess it was made aware of. I can't go back in time and I can't change as much as I want to, trust me, as much as I want to. And there's the people out here in the audience, they know that I have no, I can be very objective, and I have been very objective. Some people like it, some people don't. But in order to be involved, where I can hear both sides and look at everything, some of the things that was said and in public record earlier, I don't see wrong with. In municipal, I'd put people on administrative duty all the time with pay. But that was because I wanted to make sure they were available to me as part of the investigation. And obviously, we would not approve an off-duty request to work somewhere else while I'm paying full salary. Now, Ms. Marshall made some good points about valid use of taxpayer dollar and so forth, but that's a different issue. But I can't, as much as I want to say a lot more, I can't not knowing both sides. But again, I'm very transparent. I'll handle anything and everything that comes up to me and be objective as I can and do my research. But I can't go back in history and change things. And that's all I have for now.
Okay, thanks, Commissioner Chandler. Commissioner Wood?
I better make this short or we'll be here all night. Welcome, everybody. Glad you came out. Marsha, I'm glad you stood up. I'm a big advocate of freedom of speech. I'm glad you got the extra time and almost got to speak your opinion. And my best wishes are to you. Real quick, department heads, thank y'all so much. We just went through a marathon of work session, I think about 20 hours, and a lot of good information come out. And we cannot fix everything at the snap of our fingers, but we got a list to get to work on. Thank you, everybody, for coming again.
Mr. Cox?
Yeah, I would like to thank everybody for being here today. And Marcia, I'd like to personally thank you for your years of service to this county and for giving a lot of time, 24/7, to this county for 28 years, and for your dedication to the county. And now can't think of any other better second job than working with the school system and helping the schools, because they desperately do need subs. And thank you for that, for giving yourself and your time to the school system now. But as Brad said, there are limitations to what we as the commissioner board can do or say about this because of the way the statutes are. Like Marcia said, she filed a grievance with the commissioners, but our attorney told us then that we didn't have any authority over that we couldn't hear that grievance because that had to be just the DSS board. And then when the DSS board got the grievance, we were basically told it was still an investigation, and so until any findings took place and that there was any type of discipline for the findings that Marcia's discussed, we really couldn't act on it. So that's where, our hands got tied in that process, because I serve on the DSS board. I was the commissioner appointed to that board. So I've heard more from I won't say I've heard both sides. I've only heard really Marcia's side, like what she talked about today. And the other thing I've heard is just that it's under investigatory status or whatever, like you said, so it couldn't be discussed with us. So that's pretty much all I know about that. And that's why the Board of Commissioners never heard a grievance, because we were told it wasn't our place because the DSS board is there for that. So that being said, I don't think it was handled inappropriately. I just think that's just the best advice that the attorney gave us to follow at the time. Personally, I've got a lot of concerns about the lack of foster parents in this county. I do think that strides need to be made to get more foster parents in place, and hopefully the support that they need from this county, from this DSS department when they do have these kids, because they're the key to making all of this work, is having dedicated foster parents, because they're the ones on the front line. It's really not the social workers as much as it is the foster parents that are taking care of these kids, and they all have trauma. And if I say much more, I'm just going to get real emotional, because I feel for these kids. And it's a problem not just countywide, but statewide. And we have Kara here from Vine. She can talk more about that. So, there's a big gap in services across the state, but these foster parents have to be supported, or there's other agencies they can choose to go with, and that's what they're choosing. And I don't know all the reasons for that, but I would like to see us really support these people who agree to take on that job as a foster parent. And on a positive note, I will end on congratulations to South Stokes basketball team. I'm getting ahead of myself. Baseball's already started. Basketball is still continuing, and we have South Stokes who've made it to the Elite Eight, to the regional final, which is tomorrow. Do you know what time?
7 o'clock.
7 o'clock tomorrow night. Get there early. The opposing team wants to make it their home team advantage, so they're planning to pack the gym, so we need to be there to pack it before they can get there to pack it. But to make it this far is a huge accomplishment. I'm really proud of them. That's all I have.
Thanks, Mr. Cox. Shannon, you got anything?
Yeah, the game Saturday night was amazing. They played Bessemer City, and I think our boys had about 4 different dunks. It was an awesome game, so I'm proud of that. Awesome. I've got just a couple of things. I'll be fast. I know we're way off schedule. Congratulations to Marsha on your retirement. No matter what, you've got 28 years of service to the kids in Stokes County, and I wish you the absolute best in your retirement and hope you have lots of days filled with peace and tranquility and quiet, and keep doing what you're doing, and it's just spend time with your family and do your stuff. But one thing I did want to mention is at the animal shelter on Tuesdays, it started last week, tomorrow's another one. They are doing a rabies vaccine for county residents. So $10 per vaccine is first come, first served, doing it starting. You can sign up at 1 o'clock. You go to the facility at the shelter at 1999 Sizemore Road. Get there, do your paperwork inside, and then they'll come out and they're doing cats, dogs, ferrets. So just if you need a vaccine, they're doing 1 year vaccines right now. Eventually they'll do 3 years, but it's a good cost vaccine if you're in need of a rabies vaccine. So that's a good thing they started there doing. And I just wanted to mention the Fain family in Stokes County that's been missing their child, I think, since early February, just to continue praying for that family and some peace for them and hope they find their son safely in the couple of days. I can't imagine what they're going through. It's a nice family from the Westville community that's been missing their son now for quite a while. So, I think that's it for me. So.
All right, thanks, Shannon. I'd like to welcome everybody here in the room and virtually that are participating with us today. I'll just make one comment on DSS. If the statutes haven't changed, the Commissioner Board has the authority to dissolve the DSS and health boards. We did that one time during my tenure with local government, and it didn't work out well. So they were then reestablished, and I would never recommend disestablishing them again, but just FYI. Okay, the next item on our agenda is conflicts of interest. Before moving further, does any board member have a conflict of interest with any of the items on the agenda for tonight, or one that could be perceived as conflict of interest? Nope. All right, next item on our agenda is the consent agenda. Can I have a motion for approval of consent agenda?
Motion.
Second. Any discussion? All in favor say aye. Aye. Opposed? Motion passes.
Can I ask a really quick favor? I'm sorry.
Yeah, sure.
It's almost 3 o'clock, and I know we're way into this, and I know everybody here is busy and everybody's time's valuable, but I know you've got Lori Shore here from Animal Control, and she's pretty far down the agenda. And I know the more time she sits in this meeting with us, the more time she's getting backed up on calls. Is there a way we can bump that item up a little bit to try to get her on the road? Because
Board
she
Judge,
hasn't asked for that. I'm asking for that because I know.
Making it first on the agenda, on discussion agenda, is that good with everybody?
At least if we can get her
That's fine.
to that
Okay.
point, get her
Yeah,
out here
we'll do
faster.
that. We can do that. We have a consensus.
Okay, thank you.
Okay, the next thing we have is the information agenda, and the first thing we have is Walnut Coast Senior Center recognition with Director Vicki East.
Good afternoon. This will be quick, I promise. Just wanted to come before you today and recognize Miss Reba Dodson, who is our Walnut Coast Senior Center Coordinator. She was just recertified by the state as a Certified Center of Excellence, and that's no easy feat. This is our 4th recertification, and there's a lot of work that goes into that, so I just wanted to recognize her today and tell you guys what a great job she's doing and what an awesome job she did putting all that together. They were there at 9:30, and they were gone by 11. So that's record time. So I think she did a superb job, and I just wanted to recognize her for that today.
Thank you, Vicki, very much. You know, I've been associated with you guys down there for many years now, and you have delivered many, many good services for the seniors down there. And this is just an example that's continuing. So congratulations. We're really proud of you for doing that. Other commissioners want to comment?
Yeah, definitely. Thank you so much. Yeah, we appreciate all of the work you do down there. Sure.
Yeah, I just want to say, I've been down there several times, and I know these 2 young ladies very well. Since I lived down in that area. Thanks for all you've done and are still doing. You make Stokes County proud. and we appreciate that. Thank you.
Thank you so much.
We
Thanks,
have a
thank
picture with Reba and you guys just so I can send it to the paper.
I got some, thanks a lot. I've been involved with Paula and King, and we are lucky to have two in this county. And the best thing, it's not just Want Cove and King, y'all are spreading the love over the county. I dropped in at Lawsonville at the sit and exercise, and they had 28 people there on Wednesday. I think it's at 10:30. I'll do a plug. Correct me, Roger, if I'm wrong. But it was awesome, so thanks a bunch.
And you want to do the photo?
I'm gonna put Reba in the front right here, let you all just kind of gather around behind her. Yeah.
I'm not gonna push it. I don't want to push a chair.
Roll back on me. Roll back over me.
Thank you, Reba.
Okay, the next item on our agenda is our Via Health update, and Kara Townsend is here to do that for us, so please come forward.
Well, good afternoon. I'm Kara Donor. It's a pleasure to be here and meet the new commissioners in Stokes County. I always love coming over here from Guilford County. The drive is gorgeous. But wanted to give you our quarterly update just to make you all aware of what VI is, since this is new. I don't know if you can hear me. We're a managed care organization, one of 6 in the state. We are given money from the state government to manage care for people with Medicaid, people who have intellectual and developmental disabilities, substance use disorders, and also foster care. So there's a lot going on. In the state right now, we're doing a transformation. And so what's going to happen is where you have the Blue Cross Blue Shields right now, United Healthcare, who provide just physical health, VIA provides just mental health right now. And so the state decided that we needed to have total person care. So what's going to happen is we're going to be starting to do mental health and physical health, and Blue Cross will be doing mental health. So that was going to go live on April 1st, but we aren't quite ready with providers across the state. It's a big lift. So that is delayed, which will give us more time to prepare, honestly. But it's a pretty big deal, and we're excited about it. We will also be providing a pharmacy benefit to people. So I just wanted to make you aware of that. But every quarter, VIA comes in and gives an update on how we're performing in the county, just because of everything going on. So I'll go ahead and start with that presentation. So this is just a quick graph, and we're required by the state to show everyone these numbers. I'm sorry, I don't know why that's doing that. But you can see that most of the population we serve are adults. And at the bottom, that's people with intellectual and developmental disabilities, mental health for MH, and substance use disorders. And non-Medicaid can be anyone in the state. It can be someone with private insurance that just happens to need a service provided by us, or it can be someone traveling through North Carolina that's not even a resident. So this is a great slide that shows you kind of a breakdown of Medicaid in the state. So you can see that outpatient, that's our biggest number of people we serve. Some other things I'll point out, the innovations, that's that big orange chunk. That's people on our innovations waiver. And Chairman Morris, you had asked some questions last time, and I came back with some answers for you on that. So the innovations waiver is for people who receive really full-time care, who would otherwise be institutionalized. So you can see right there, that 50 number, that's how many people are receiving the innovations waiver in Stokes County. So the deal is that 15,000 people are waiting for a slot in the state. It is expensive. That's one of the questions that the chairman asked last time. So the max is $135,000 per year. And where that seems like a lot, but someone institutionalized, it's more than double in cost for the state. So the state legislature has decided that we need to add 500 slots a year, which I don't know if that's aggressive enough given that 15,000 people are waiting for the services. But North Carolina has become a very institutionalized state, and so we're trying to pull that back. And so every year, each of the MCOs, we're given a number of people we're trying to pull out of institutionalized care. And it's amazing with community supports and care management what we can do, and people can really live really well in the community and not be in an institution. So a couple other things I'll point out. So you can see people at intensive care facilities. That's another interesting one. And then crisis services up at the top. You can see that 7 people were served. So we have something called mobile crisis, and we are supposed to be responding, our providers, within 2 hours of someone calling this number. So that's something that we hope to get more education out in the county about these services. So if someone, is having a mental health crisis, they know the number to call. And so we're trying to be creative with our counties to maybe come up with a video to help educate, so that people, if they go to the county website, they can see a video and say, okay, here is who would qualify for this. And you don't have to be on Medicaid. It's for everyone, but it's just being underutilized. So I just wanted to point that out. So I'll just focus on the left side. We can just go down a few. So these are your biggest providers in Stokes County, with Daymark being the biggest. And then Youth Haven Services, specializing in kids. So you can see on down the line of how many people are being served with what provider. And like I said, here's another slide about the innovations waiver. So you can see that people who have a waiver right now, 51 people have that. And you can see the people who are waiting on the other side. So it can be, people can wait 15 years for a slot. So people try to get their kids on the list, but it's just, you never know if you'll get that. Now we do, the state does provide services for people who are waiting. It could be respite care, it could be help with workforce development. So there are services they can get while they wait, but it would be nice to have more slots. And that is all funded through Medicaid. Chairman, you had asked that question before as well.
Uh-huh.
So you can see the community hospital inpatient admissions for mental health. They kind of fluctuate. So VIA was consolidated, Cardinal Health was consolidated by VIA. So you can see kind of it's changed a little bit as the years have gone by. But the overall readmits are pretty low. And then here's the same kind of graph for substance use disorders. So that's low in this county as well. And here you can see people who are actually getting care. 35, it's adult and child mixed together. So, and the other side is the innovations waiver. So it is the most expensive that the county is spending money on. Well, not the county, the Medicaid budget. And this is just a quick slide showing the follow-up after discharge for Medicaid. VIA consistently performs above the average of the state on this one. And this is emergency department admissions and readmissions in 30 days. So you can see that's gone down quite a bit. And I just wanted to give you some updates on what we're doing here in the county. We've had a lot of success with the substance use steering committee. So that's been handed over to the county via kind of help got off the ground. Sorry, I'm tongue-tied here. But it's been very successful. So we're working through a lot of things like the opioid settlement funding. We are a resource for that. I know that a lot of people want to make some decisions on how that should be spent, and all the counties across the state are busy working on that. I mentioned increasing mobile crisis awareness. October Road is coming to Stokes County. We're just kind of finalizing the construction, but that will offer medication-assisted treatment and also some mental health services. So we're really excited about that. Hoping to have an opening this spring. So of course you will all be invited for that. Another thing I wanted to mention is the crisis intervention team. So training. So this is something that law enforcement officers, EMT can go to learn kind of what's the latest strategies on how to deal with a mental health crisis. Sometimes it's hard for people to get off work to attend, but we always would love to increase participation for that. And then, kind of gone out of order here, but the top one, quarterly crisis community response meetings. Those are going really well. We just take all of our partners across the county, from EMS to Department of Social Services to law enforcement, and get together and just discuss what is working. You know, are there gaps in services? Really a great meeting of the minds. It. And we are going to be doing these listening sessions twice a year just to see how it's going for the county. It's a good way. It's also a good way to share ideas between counties because everyone's kind of working on the same goals. So it's nice to not have to reinvent the wheel. But I would be happy to answer any questions. Yes, sir.
Could you just give me the dates in advance for the listening session? Like from EMS and the sheriff's office and so forth, I'd be interested in, I don't know if you're doing in-person meetings or if you're doing, I'd be interested in attending that.
Wonderful, and you are welcome to attend our crisis response meetings as well. I can let you know.
Go ahead and give me that date too.
Okay, I will. Great.
Any other questions? Sonia?
I don't really have any questions except for, I don't think you touched on it, but the Medicaid expansion that's coming up, I mean, how do you foresee that playing out, or how much more of a burden is that going to be? I mean, I guess it's good in some aspects to give increased services to people, but also it's going to require probably more workers or whatever.
Yes. I can't speak on how it will directly impact this county yet. I was in Chatham County this morning, and 4,000 additional people will be able to receive benefits.
Mm-hmm.
The problem currently is that a family of four, if they make, I think the threshold, if they make over, I think 11,000, they don't qualify for benefits. So it's very interesting. There are also hidden populations. So, you know, we're saying we might be able to cover 600,000 new people in North Carolina, but there are a lot of people who, you know, don't currently apply for services right now that will be applying for it. But it will open up care, and it will really impact care for people with substance use disorders.
Mm-hmm. Speaking on that, thank you to VIA for the peer support training that y'all did. That I think we had many people attend that and get trained, and a lot of them are going to work through Mary Lee and the Stokes County Mental Health Association. Hopefully, we can expand that and get even more people trained. But that was great that VIA provided that training.
Well, I was very impressed with Mary.
Yeah, for sure.
And we are also, we're giving money to Exodus Ministries for recovery housing. I don't know how much. I just found out before I walked in. So
that's awesome. That's good news for sure, because Tamara Lilly does a great job with that. She's really, really impacting the homeless population too, with some of her things that she's reaching out with, because most of those are involved in substance abuse as well. So you heard us talk a little bit about foster care and the problems that we're facing. And while we've got you here and got your ear, let me just really advocate for the placement of these hard-to-place kids. And, you know, we have workers having to stay with these kids almost every week because there's no placement for these kids, especially the harder-to-place older kids or behavior problematic kids. And we just could... anything VIA can help us with in that regard, we would really appreciate.
yeah,
I'll just say.
I hear you 100%, and I actually just met with Stacy Elms before this, and she's been a great advocate for the county in trying to place people. You know, we'll talk all weekend long on how to address the problem and get things solved. So I just wanted to mention that.
Yeah, I know they're reaching out to you, but I just
Yes.
wanted to put our input as commissioners into that equation, how much we need help and would value any help you could give us.
Yes, and I just also wanted to mention, you know, some counties are doing some creative approaches, and I've mentioned this, but Rowan County has figured out a way to have emergency housing, and they've used some of their funding, and we're happy to help kind of figure out how to do that here in this county. But that's a problem statewide.
Yeah,
All
housing-
counties are
housing is
having
a
a problem with
Mhm.
you know, not knowing what to do with these kids.
Yeah, thank you,
It's heartbreaking.
for sure. That's all I've got.
Commissioner Wood, you have any comments or questions?
Yeah, can you give us more details about this October Road program?
Yes. So October Road is a provider that we've been trying to get situated in Stokes County for quite a while. We've had some issues with location. One rental agreement didn't work out, but they are based out of the West, and they have a great track record on providing medication-assisted treatment. And, you know, that's Suboxone, that's getting people off, you know, taking regular drugs with, you know, some other kind of therapies. But they've been really successful. I'm not a spokesperson for them, so I'm not giving them justice. But we just heard that they'll be able to offer mental health services as well
Right.
in this location, which is awesome because
Yeah, they will do
yeah.
the complete wraparound services
Yes.
for people. You don't just go in and here's you something and come back tomorrow and get something, or they have to go to meetings and treatment and mental health, and the whole thing is looked into. It's not just a place to get
Yeah.
Suboxone.
Yeah, because many times, you know, there are more things going on than just.
And if I can interject this, I know we're running behind, but it's really important to understand, and maybe it'd be good to have your specialist, the doctor that spoke to the committee, explain how this is working, because most people are not on one drug; they're on multiple drugs, and they are the fentanyl is usually somewhere in the mix, and to get off of those. The only thing that's really working, and they're seeing any success with getting these people clean, is medical assisted treatment, because it's just, you can't get them clear-headed enough to want to go into treatment unless they can kind of ease their way into it. It's very successful. The track record is really good for it, and it's really because of the amount of multi-substances that people are mixing and using. It's really bad. I mean, it's about the only thing they're finding that works. So.
That's true. And Dr. Zen he's
Dr.
our
Zen,
chief
yeah.
medical officer at VIAD. I'm
He's
sure
good.
he's happy to come
He's
here.
been here and spoke to our committee, yeah. he's
Yes,
good.
and he's a licensed psychiatrist, so you always get some good nuggets from him.
For sure.
You got anything else?
That's it. Thanks.
Commissioner Mendenhall?
Just want to say thank you for all y'all do. I've met you before, we've talked at some of the conferences. Mental health is very, very in the forefront right now. You know, I'm sorry that this situation has occurred, and I'm not certainly going to look, but as Commissioner Cox stated, fentanyl, I actually called the sheriff the other day, Sheriff Lyman, and he said there was an uptick big time even in Stokes County. Some people may not realize, you know, Stokes County's, we're a small county, you know, but he said there was a definite uptick in the usage of fentanyl, and you know, I don't see it slowing down, not with the situation with the, I'm I'm just lay it out there with the situation with the southern border right now. It's coming in all the states, and you can hear it every day on TV. And but for everything y'all do, and for the services y'all provide, they are just tremendous. I've heard a lot of positive things. I just want to say thank you.
Well, thank you. And I will say that even though Stokes is a small county, they are focusing on small counties. So in Caswell, another one of my counties, the smallest county I have, they have a DEA agent, a U.S. Marshal, and an FBI agent all stationed in that small county because of the drugs that are being hidden. So, yeah, happy to continue working on that issue.
Thank you.
Thank you very much.
Eric, one thing before
Oh,
you
yes,
go.
yes,
I'm
sir.
curious, how many CIT trained people do we have in the county compared to what we need to have or target to have? And who,
No, but
You know-
I can
you know,
find out that
Shannon?
answer.
what's our objective for the number to have? Is it a certification that comes with that when you get CIT trained?
It is. It's one of the problems is that it's a 40-hour training. And so a lot of the times, smaller counties can't afford to send an officer for that extended period of time. So they could be coming out with something that's, maybe just a refresher course so people can understand, kind of what we're dealing with at this time and know the resources available. But I'll find out how many people have been trained.
I'm just curious if we're anywhere near what we need as far as that goes. We can research that, maybe internally even do that, so. Otherwise, thank you for coming. Good presentation.
Yes, sir.
Thank you.
Thank you.
Okay, next item on our agenda is Register of Deeds quarterly report, and Brandon Hooker is here to present that.
First, I want to say thank you to the board for having me today. Second, senior services, I want to put a plug in for them too. I'm on the aging planning committee and I work with those folks, and they are doing, Paula and Vicki and Reba are terrific, and I'm lucky to have them. Third, I think this is my last meeting with Shannon, so in presence, I want to thank you for being easy to work with and wish you the best.
Thank you, Freedom.
All right. Our numbers for the past quarter, the second quarter, which was October the 1st through December 31st. Can you hear me okay? I don't know if this is on or not.
Is it still lit up there, the DCF?
Yeah, it is. Total recording fees for the quarter were $53,116. And the excise tax, I just saw a typo, it says excise. It's supposed to be excise tax, sorry about that. $108,983 for a total for the quarter of $162,099. 493 deeds for the quarter, 306 deeds of trust, miscellaneous documents, foreclosures, powers of attorney, anything that can affect property. Plats 59, 119 death certificates for the quarter that we recorded. We issued 53 marriage licenses, issued oath of office to notaries, 50 of those, notarized 10 signatures, and there's our copies. The number of transactions for the quarter from the quarter of the 2021-2022 fiscal year was just over 20% drop in the number of transactions, and revenue was a 32, almost 33% drop. So we're seeing some leveling off now from the peak during the recent market uptick. So it's leveling off a little bit, seeing a little bit more return to normalcy. Our excise tax is still up. Sales are still a lot higher than they were 3 years ago. Conveyance tax, which is half of the excise tax there at $54,491.50. The state domestic violence center collected $1,590, and the state children's trust fund $265, and the state treasurer's office $6,960. $63,247.10 remitted to the state, for a net revenue for the quarter of $98,851.90. Outside of the numbers for the last little bit, we've got a new employee in the office, Judy Puckett, that had been with us for 3 years, stepped aside and has gone home to take care of Leon and herself and the rest of that big family. We appreciate her service. I want to thank her publicly for her stepping in there and helping us out for the last 3 years. Her work with the public is beyond what I could have hoped for. She was very good to work with, and everybody that walked in the office saw her smiling face when they come in, and she was really good with the people. Cynthia Collins is our new employee. She's currently working, currently training on the job. She's catching on very quick. She's young. She's soaking up this information quickly. She's got a customer service background that's helping her out a lot. We're going to get her in a notary class in the next month or two. And so she's doing great. Think of that program's going very well. The veterans have all been very appreciative when they come in and get their card. Still working on getting businesses. A new article in the paper was run about 2 weeks ago about the program. So we're trying to get that word out more, identifying businesses to maybe give a little personal touch, send them letters. We got to find some way to get them signed up. So I'm going to probably start with some of the national chains first, and then some of our long-standing businesses, and we'll go from there and get more of the word out. Working on the ancestry program I mentioned in the work session. I'll do that sometime this summer. The property notification service that we've had in place, I've been sending out letters to the grantees on our deeds when they come in. If someone has a deed filed with their name on it, if they're getting full interest or partial interest, any kind of change in ownership, the grantee receives a letter from our office letting them know about property notification. It's a free service. It's good to keep track of your property that way. Make sure no one's filing anything in someone's name. It's a very good service to discourage fraud, which has been one of the highest white-collar crimes there is in the country. Final thing I'll mention, perception is everything, and I will be taking a leave of 2 weeks up to 3 in the coming days. Just if anybody comes and says, where's the register of deeds, he's never there. I'll be gone for a couple of weeks or so coming up in the next few days, I hope. We'll see. So I just want to let you know about that. So that's all I have.
Thanks. Any board members have any comments, questions?
Yes, thank you. Appreciate the information.
Thank you.
Good update.
Thank you.
Mr. Commissioner, I'll make a motion, just take a 5-minute break.
Okay, let's
Run through.
recess for 5 minutes. Okay, I'll call our meeting back to order from the 5-minute recess, and we're going to rearrange the discussion agenda and have Lori come up first, as we discussed earlier. So it's the request for additional animal control staffing.
Good afternoon. I do have a few statistics for you that we have tried to gather. So this morning I had Mandy start. I said, if you can try to count the calls that are coming in just from the time we walk in until, you get back from lunch. And today it is a Monday, and there were 158 calls that came into the shelter between 8 a.m. and 1 p.m. And right now we have 3 of us that are trying to answer all those calls. So as you can see how thin we are right now. And as far as dispatch goes, I did get some numbers together from dispatch. So monthly average on dispatch calls, which are the emergency calls that we do respond to after hours, which we do not respond to strays after hours. We just do the emergencies, which are sick and injured animals, severe neglect, and attacks, bites to humans. We are averaging 32.625 calls a month. We've had 26 animal attacks / bites. We've had 86 animal welfare calls. Majority of those are chained animals. All other emergency calls are 149. That's been since I came on board. So most of those calls have been since we have taken back enforcement, which has been the last few months, or that's the majority of the emergencies after hours from dispatch. Like I said, today, just between 8 a.m. and 1 p.m., we've had 158 incoming calls. We are doing the rabies clinics now, as Shannon said, on Tuesdays from 1:30 to 3. We're trying to knock out at least 20 during that hour and a half. And the faster we get at it, the more we'll be able to process through. So that's a little income for the shelter, but it's also getting these animals out there vaccinated. So hopefully that will cut back on our quarantine animals in our cages. Today we are completely full of animals, and out of a lot of those calls this morning, it's requests to come pick up strays or aggressive dogs. We have nowhere to put them. So that's kind of what we're dealing with. Just to give you a little bit of statistics on as far as cost per animal, I did get the Department of Ag reports turned in. We still charge adoption fees of $100 for cats and dogs. The veterinary expenses that we incur just in the shelter, where we're saving money by doing our own vaccines. We do rabies, bordetella, canine distemper, feline vaccines. We're doing microchips, which helps us actually track these animals. We've had some animals come in as strays, and we've been able to reunite them with their families because of our own microchips. So that is making a lot of progress. But as far as the money that we put in the shelter, in the animals, the male and female canines are about $42.57. Then we have the veterinary expenses, which are the spays and the neuters, that range anywhere from $120 up to $192.50. For felines, in-house, we're using about $26.80. That's for their vaccines, microchips and all that. And then the vet expenses for spay neuters are anywhere from $52.80 to $79.60 per cat. So all in all, dogs range from $162 to $193 a piece. Cats range anywhere from $50 to $79 to $80 a piece. So as far as staffing goes, what I'm asking for desperately is a dispatcher to answer these just crazy incoming calls every day, and dispatching the officers so that Mandy can do her job as kennel manager in the back, because we're just so overwhelmed in there. And I realize we're limited on space because we don't have a lot of space to put many more people, But I do have a space to put a dispatcher and one more animal control officer. We would just need a vehicle for that animal control officer. So as you can see with the call volumes that are coming in, we're desperate for more help. Trying to spread 3 or 4 animal control officers across the county from Westfield, Pilot Mountain, all the way to Sandy Ridge, with this amount of calls coming in every day, it's difficult. We're getting backed up. You know, we're getting backed up on calls. We're kind of triaging the strays that are not aggressive. We're kind of having to put at the bottom of the totem pole. 1, because we have no place to put them. 2, because those animals are not causing that much of a nuisance. If it's aggression or, you know, something like that, then we bump them up, of course, to higher priority calls. But that's kind of that's just today. So hopefully that can kind of give you an idea of what we're in need of.
You've got a job description on your agenda for that
Yeah, the
dispatch
dispatcher
/ office manager, because that's not a current position, and a grade recommendation on there. And as what you requested the other day, we talked about that, went through, Jamie took a look at that Friday from HR, made a few adjustments to it and did that, so that's on there for you guys to look at. So,
Thank you. All right, Commissioner Mendenhall, you want to go first on this one?
Sure, thank you, Mr. Chairman. I would say her comments in her first sentence shows a need, certainly, for a dispatcher. The time you walked in the door to lunch, you had 158 incoming calls, is that correct? 158 calls.
That's what she said.
And you
That
have-
was from 8 a.m. until 1 p.m. today.
You got how many people answering the phone?
One who's trying, and it rings off the hook.
And you have how many people altogether in your department right now?
Right now, we have Mandy up front, Brittany in the back is kennel tech. Natalie is doing the veterinary medicine, you know, doing all the injections and all that. And then it's myself and Adam Teague, another officer, Bobby Smith, another officer, and then Jamie just started Monday, and he's in training. So,
Mr. Chairman, the only thing else I gotta add is I can certainly see the need for a dispatcher, like getting that many calls, you know, 158 calls in half a day, incoming, and having to dispense the officers out to the right places to go, you know, making sure the ones that are really serious, they get the first call and send them to the right places. You know, might be something that's not very serious, they can hold off and say, hey, when you get the time, get to there. But I'm looking at this dispatcher office clerk job description. I read over it. It looks good to me. That's all I have.
All right, thank you, Commissioner Mendenhall. Commissioner Chandler?
Yeah, I concur. It'll improve the efficiency of the unit, and then also allow you to continue again, just to keep good numbers as we go through with the recommended immediate purchases and the hiring. As we move forward from where we were to where we're going, we just need to be able to look at the results that we're making. That's all I got. Thank you.
Okay, Commissioner Woods.
I see the need, but I have a problem with nothing's changed in this county in the last 30 years. And I hope you got a plan.
It's changing, I can promise you, it's changing.
The citizens
We
are getting restless.
We're responding to calls, and we're doing everything that we can possibly do with the 10 kennels that we have for strays and owner surrenders. We're doing everything we can possibly do.
I know you are. It's just, we just got to have a plan to educate the people some way and make the people pay. I mean, these irresponsible people that shouldn't have an animal shouldn't be getting them, or they should pay dearly for them. That's all I got.
Commissioner Cox?
Well, while I agree that, you know, about the people about paying for them and paying dearly, at the same time, I just saw a thing on the news where another county were cutting their adoption fees just to clear out. They don't have any space either. I don't remember if it was Randolph or it might have been Randolph, but they were just cutting the fee almost entirely just to clear out to make room. Do you ever do anything like that?
Well, we have tons of adoption sponsors, though. People sponsor them all the time, and they don't have a fee when they are approved
I
in the
got you.
adoption process. So we have tons of that, but even that sometimes doesn't help. And you don't want to attract the wrong kind of adopters by giving away free animals either. Plus, we have a process for that for vet reference checks too, but we have a lot of people that
Right.
sponsor the animals.
I figured it was probably a last resort type thing, but, you know.
I personally do not agree with these low-cost adoptions where they adopt out animals for $10 or $20. And the reason I do not agree with that is because I've been doing this kind of thing for a long time. And what I have found is that if you adopt these animals out for very cheap, then those people are the people who do not seem to be able to afford veterinary care. So if that animal runs out the door, gets hit by a car, they don't take them to the vet because they can't afford it. Or if they get sick, they don't take them to the vet because they can't afford it. So I just personally feel like if you can afford an adoption fee, you're gonna, probably more than likely take better care of that pet. Because when people, don't have anything invested, they seem to not take as good care.
Yeah.
So we
Do
do
you
do
do that
vet
argument?
checks and we're checking people out thoroughly
Right.
that do adopt from us, but,
And if you've taken a cat or dog to the vet lately, $100 for all of your shots, microchip, and a spay or neuter is
Oh, that's a deal.
That's
For
a
sure,
treat.
that's a deal.
so it's yeah.
I don't really have any other questions.
Thanks, Commissioner Cox. I was just going to ask that question. Shannon, I think, kind of answered it. What does the spay and neuter, the adoption fee cover? It's,
the adoption fee actually covers the spay neuter, the microchip for dogs, the heartworm test, the canine distemper, parvo vaccine, your rabies vaccine. It covers deworming, any type of flea treatments that's needed, anything like that. So it covers.
And the Bordetella.
Yeah, and the Bordetella. So it covers a lot, and if you go to the vet and pay for that, you're probably looking at least $300.
oh yeah, I guarantee it.
So, anybody that adopts from the shelter gets a great deal on an animal. But if we lower that fee, we're not even breaking even now because the veterinary
Yeah.
increases have gone up so drastically in the past 6 months that we can't break even, honestly. If we adopt an animal out for $100, we've still got about close to $200 invested in it when it walks out the door. That's due to the cost of the spay neuter increases. So
Is that something we should look at in the budget? If you put it up too high, will nobody adopt them if you go
that's what I'm
200?
afraid of.
Yeah.
You're trying to hit that balance.
In this county, I'm afraid to bump our adoption fees up too much. I think at some point we may have to increase it by $25 or something, but just we're moving them as fast as we can into the best quality homes that we can find. So it's just, it's difficult. And this is the time of year where we're getting ready to get bombarded with puppies and kittens because it's, spring's almost here and we're already getting calls about puppies and kittens every day. So we just don't have the resources to keep up with the need.
Did you just have the phone system upgraded out there? Has it been done already?
And not yet. I think that's
Getting
coming
ready
in the
to,
next couple
right?
weeks.
Well, when you get all these calls, the ones that you can't answer that many, so do some of them go to message? Do all of them go to messages?
Not all. If
Do we
she's
lose
on
some
the
of
phone,
them
taking
completely?
in a call, then of course it'll go to voicemail and then she'll take that call in.
But are some of them we're completely missing them because they're not either going to voicemail or getting answered?
No, they should be going to voicemail.
It should be all of them. The ones you don't get answered should all be going to voicemail. Okay.
Unless it's after hours.
Oh,
Then
okay.
they'll get the machine that tells them, that if it's this, or this, you can call dispatch. And if it's not, to call back in normal business hours.
Okay. I would just note that, in addition to the discussion today, we've spent probably another 2 hours with you during the last month talking of details of this stuff. And during that discussion with all our department heads, we had 2 departments that we determined needed immediate action. Yours is one of them and IT's the other. And so this is taking steps to address those concerns, and we've done the same thing with IT as well. So.
Thank you all very much.
All right, that's all. Is this action today? Does it need to be, or next time?
I mean, it would be nice, we could post the ACO position if you're approving that, and also post the dispatcher. The faster we get them posted, the faster she can get some help. Because getting that other ACO is gonna enable her to spend more time in the shelter doing all of her state reporting and other reporting, because she's right now just acting as a director and a regular officer all the time.
What's the pleasure of the board for today, action or next time?
I'd recommend action today.
Action. You good, Ronnie, action?
Fine.
Okay. Amber, please put on an action agenda then.
Thank you very much.
Thanks, Lori. I think we're back to Richard now. Tax office agenda is next.
Good afternoon.
Afternoon.
How you doing?
Doing good. Just like always, the first item we have is our monthly tax collection status report. We've collected $24,995,313 for the general county and school operating, or 96.5%. We're about $796,000 ahead of where we were last year at this time. Moving right along to our real and personal releases less than 100, we have 3 accounts that total $181.91. And refunds less than 100, we have 1 account that's $15.05. Releases more than 100, we have 2 accounts for $534.77. And then the last category, refunds more than 100, we have 5 accounts that total $946.76. And then the time to apply for present use value is the month of January to make timely application, but there is a provision in the law for folks to file a late application, and the board has the right to approve those if it's made in the calendar year, and we have 2 of those. And then the final item I have is just about the advertisement of the 2022 tax liens on real property, and we're very close to where we were last year. It seems like a lot of people typically follow the same pattern in how they pay, so we have those, and we're going to notify those folks with a second notice around the first week of March, and then the ones who haven't paid, we're going to run the advertisement in the paper the next to the last Thursday in June. By statute, we have to do that. So that's all I have. I am requesting to move real and personal releases, refunds and releases more than 100, the present use value, late applications, and the advertisement of the 2022 tax liens to the March 13th consent agenda. That's all I have.
All right, thanks, Richard. Any questions from board members or whatever?
I don't have any. Thank you for a good report.
We'll do that.
Thanks.
Hey, next, I think Jamie or Gail are going to talk about the background check policy.
Good afternoon.
Hello.
So the first thing that our office has on the agenda this afternoon is the background check policy. Per our conversation at our January 17th work session meeting, we discussed revamping the way that we do background checks for our employees. So in order to maintain a safe work environment and protect company assets and also reduce the risk of liability claims, we felt that the way that we address background checks at this time is not as good as it could be. We felt like it really needs to be made its own separate policy. So right now, the way that background checks are touched is in our employee handbook under appointments, and it's only for new hire employees. And we just suggest that, or we require employees to bring a background check from the county in which they've lived for the previous 5 years. So in all the documentation that we provided you, I have done a little research to see what other counties are doing. I reached out to several counties, and then I also posted this on the HR listserv, which is statewide, and did get back some response that I put in y'all's packets. And then at the same time, I've also provided a draft policy for y'all's review. And in this policy, we would like to have background checks done for all new employees, all new hires, anybody who is promoting to a new position. And we like to have this outsourced through a third-party vendor. In doing that, we're going to incur some cost associated with these background checks, but we feel that they'll be better in the long run. And I again, when I reached out to these counties to see what they were doing and what was working for them, I also reached out to see what vendors they liked the best and which vendors were most often used. And that's how I come up with these 3 vendors that you have, which is Catapult, BIB, and First Point. And after doing my own research, I think we're going to be better off, from my opinion, going with the BIB, which is who Stokes County School Board or Stokes County School Systems use. And the reason I like this is because you're getting more bang for your buck when you're doing your background check. And then at the same time, they have a 24-hour monitoring service. So for any initial applicant that you run through the service, any criminal, anything that happens between now and the time that they're working with you, you get dinged or you get notified should they acquire some kind of criminal record during that time. I also wanted to note that at the bottom of this draft policy, I did state that the Stokes County Sheriff's Department may have pre-employment procedures for background checks that are more stringent than stated in this policy. And we all know the reasons for that. But do y'all have any questions?
Mr. Chandler, you want to start on this one?
I think that, I think it's a good policy recommendation. And I think of whatever terms of monetary we have to come up with to, in the budget, it will pay off in the long run. Not just for the actual safety of our citizens and our fellow employees, but also for liability.
Correct.
Thank you for doing the work.
Commissioner Woods, you got a comment or question on this?
No, good job, Jamie.
Thank you.
I've got a few.
Go ahead.
Okay, I do. Let's see. So what we're talking about is just the final candidates that are being recommended we would do this for. Okay. Because in the past, it was if you were getting interviewed, you had to go get your own thing. So we wouldn't do that anymore.
No, we would want to do this before we made our initial employment offer for the final.
Candidate. Okay, I like that. So Camden County had something in there that I thought was good, which talked about that you could review applicants' social media sites. That's probably a really good thing to consider putting in there. I mean, well, I know the school system routinely does that, when they hire somebody, but I don't know how the rest of the commissioners feel. I also think that if they're going to be driving a county vehicle, that you should definitely do the driving record check, which says that bib is not part of this package. So I guess it could be an add-on that you could add on if it is somebody that's going to be driving a county vehicle or transporting kids through DSS or something.
Mm-hmm. And from what I've gathered with who I've spoken to, most all driver records are going to come up on your criminal record search.
You should.
It should.
I would think.
I do have another meeting tomorrow to clarify that exact
Well, there's
question.
times where, and I know Commissioner Chandler knows more about this than I do, that as far as being in law enforcement previously, I guess if they were to got charged with reckless driving, blah, 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 but say they only pled guilty to or got initially found guilty of just exceeding a safe speed or something, I mean, I would want to know that that person was charged with reckless driving.
It just depends on what system that they want to run it through. So there's two different systems. If you want it through Runway, what it does, it says what the initial charge was, and then it'll give what the plea was.
Right.
And then also, even if the original charge was made, but it was found not guilty by a judge or a jury, even with or without prejudice.
Right.
The others is just, you just get what the final disposition was.
Yeah, and I don't know when it comes back, what it will say about that. But I mean, the more information you have, the better, I think, because like you say, I mean, I know a lot of times, things do get pleaded down to where it looks like, oh, that's not so bad, but then, so the more information that can be provided the better. And I noticed Iredell has the educational degree check, and I don't know that that's going to be necessary for every candidate that comes through for every position, but I could see in some instances that might be a good thing to consider doing. And it looks like I said, all this could be added on depending on what the candidate is. So maybe in the policy, you could put, not that it would be every time, but an educational check verification could be done. A social media check could be done. And I also like what Pender County said, which was the failure to reveal this is an automatic no. Like if you tell us you've never been charged with anything like that or found guilty, and then we find out, yeah, you did, then that should be an automatic. And that might need to go in the policy. That's all. That's all.
Mr. Mendenhall?
Just 2 or 3 quick things. What Commissioner Cox ended on there at the end, it's sort of similar to the first paragraph about the 5th line, any applicant refusing to authorize a background check. It's not exactly the same thing, but it's similar. And I want to make sure this also takes care of drug, yeah. Okay. And with the drug charges, so remind me, Jamie, do our employees here, do they take drug tests? Are they drug tested?
Yes, they are. I want to change that one as well. They are, as of right now, the drug test policy is part of new hire when you do your employee physical. However, our employee physicals are done through the health department, and they schedule that employee physical once they come to work for us. Now, the health department is busy, so a lot of times their drug test and physical is not done until they've been with us for 2 to 3 weeks. So that is another thing that I do want to look at. And then we do also do drug test post-accident as well.
And you did say this, the vendor we get or in the process or whatever, it'll be a 24-hour. It happens we leave here on a Friday afternoon at 5 o'clock and something happens over the weekend, Saturday, say at 8, they've been in another town and something has come up, is going to show up immediately.
Correct.
Okay, that's all I have, Mr. Chairman.
Okay. Jamie, so anybody that gets promoted throughout the organization, then they get another one, right? They get a check.
The way that we're looking at it now is every position that is filled, yes.
Okay. So things like a real big reclassification or something like that would not trigger it, right? Mm-hmm. Okay. Does this eliminate then any case where an applicant has to pay for their own test anymore?
Yes.
Okay, no, they don't have to do that anymore. Okay. I would agree with it needs to have that wording. If they lie, if anybody lies on the application and we catch it later on, they're out.
Okay.
I think that's a standard approach most places.
Okay, so in here it's worded on any current employee suspected of providing false information on his or her application or other documents. So do you want us to reword that, any current employee, or? How would you suggest wording that sentence?
You think maybe.
Oh, you're just wanting to say where they're just automatically eliminated from the process altogether?
No, they're terminated. Like even if we hire them and we catch it later, I would terminate them as well. I think that.
Current or prospective employee, like you're meaning, like even if they are considering them and they run it and it's not truthful? Is that
Right.
sort of what you're saying?
Okay.
There, too?
Well, I don't know if we grandfather somebody now since we're putting in a new policy. That's a different
Just
question.
to make it grounds for termination for.
And just make it grounds for termination
Okay.
if we determine that they provided false information or left information out on the then the last question I have is, if we look at social media, I'm not sure what the criteria is for either hiring or not hiring based on what's in somebody's social media.
That's an iffy subject.
I know, we don't have a social media policy over now.
Not pertaining to hiring employees. You're touching on people's amendment rights when you.
You're tinkering with free speech if you're not careful.
Right,
Exactly.
right. But I'm not gonna say there's not a department head that don't do that on their own.
I will say this, I think we're gonna get an answer pretty quickly, because Supreme Court is taking that up right now on big tech. They are going to have a decision made, they said, by June on that. So we might put something out to start with, we may have to amend it, depending upon what Supreme Court rules.
Well, if somebody's doing personal information on their personal device and they've done it before they ever came in contact with us, you can't just say we're going, it can't be arbitrary, I guess. Got to have some fixed guidelines of what we would consider unacceptable for hiring somebody. So to me, that's kind of a can of worms. I don't know what you guys think, but
I mean, I'm not saying one way or the other, but I know in law enforcement that, they'll look at a applicant's social media, but it's taking in the whole scope of their integrity and of, it's not just one thing. In other words, they wouldn't say, I don't like that. I don't like that post. And it wouldn't go like that. It's the whole combination. And a lot of it, of course, has to meet standards from the Standards Commission. They set the parameters. So if we did do it, it would have to be in totality, not just a singular thing.
it's hard to make it objective when something like that. So
Well, even Camden County says they check your credit, Credit Reporting Act, so,
A lot of people do that for financial positions.
yeah.
they have to be bonded too. Some of them do, right? So.
And that goes a long way. Being on the Board of Trustees for SciTech, they do a credit check on us.
Well, I don't know, Camden County's, can back up this with all they put in here on with, it'll, hold up in a court, I don't know, but it sure is in their policy.
Okay, so what specifically do we want changed on this? Anything right now, or are you guys good with it like it is for action next time?
I think it doesn't have to say it will be checked, I just think it's like this says it could be checked, can be.
About credit.
Well, credit or their social media.
What they do away from at home is their
LinkedIn.
business, is the way I feel.
Well, if somebody's lying on their LinkedIn, say, and misrepresenting themselves, then I don't know, there's some departments that might not want to hire somebody that, if say their Snapchat shows they're using illegal drugs. I mean, there are,
That's a good point.
people Snapchat, stuff like that. I don't know. I'm not saying look at their Facebook to just see what restaurants they like, or if they're on the unofficial City King page bashing Dario. I don't know. I mean, you know what I'm saying? I don't know. Maybe you could check some other counties just to see if that's a common thing in some other places. I don't know. Or how they word it. I think definitely the failure to reveal part that we talked about needs to be included in it, and the educational check could be done if, depending on what they're applying for.
Have you got enough guidance to tweak it for next time
I was
then?
going to say, don't forget the drug.
And the drug, yeah.
Okay.
Yeah. We'll look at
So
it,
you want them to
tweak it, and
combine
let's
the
look at
drug
it
as a
again.
separate policy right now?
You're on the right
She
track,
said
for
she-
sure.
She said she was going to.
What, it did this one?
Rework the drug.
Rework it and bring it to the next meeting.
Okay.
Yeah, we're on the right track, for sure.
Bring it back on action, right?
Next meeting.
Yeah, we'll bring on that. We'd still discuss it if we need to on action next time. And the next item is the implementation of the performance evaluation system, and Jamie, you're going to continue with that, I think.
Okay, so again, I've gathered more information from other counties across the state to see what exactly other counties are doing as far as performance evaluation goes. And per y'all's guidance, I drafted 2 policies, one which would include the performance evaluation policy without a merit pay increase, and then a separate policy which would include a merit pay increase. I wasn't exactly sure what exactly y'all wanted. I figured the more you had to look at, the better. In my personal opinion, when used correctly, employee performance evaluations have been proven to improve performance, increase employee engagement, clarify expectations from the department head or supervisor, allow an open door for conversation, evaluate goals, and then my personal favorite, to provide documentation. Because like one of the department heads that I spoke with about this said, you know, a lot of times you're having that mentally in your head that you're evaluating this employee and you're having talks with them, but you're not putting it onto paper. So performance evaluations would allow you to do that, and we would have a record of it for each year. Attached is the study of information that I gathered from the other counties, as well as the 2 policies that I put up for your review. I've also put together a performance evaluation checklist for if we were to implement the performance evaluations. We would definitely have to educate our supervisors and department heads on how to properly conduct a performance evaluation for each employee. We would definitely do training through our department. We would make sure that this checklist was covered for each employee. And then I've also attached a fillable personnel evaluation report there at the end, which could be filled out on the computer and not have to have 15 copies sent to 15 different people.
Good.
I did realize that we did not put a box on here for employees that did not agree with their evaluation report. So we would go back and add that onto there. And then I did notice one other little error that I made under the performance evaluation. Professionalism of rated employees, number 1, demonstrate strong professional conduct should not be capitalized. Sorry. So, I did speak with a few of our department heads. I spoke with department heads that had 2 or 3 employees, and I spoke with department heads that have 70 or 80 employees, just to get their opinion and how they feel about performance evaluations. And they had a lot of different things to say, but at the same time, I felt like they all came back to the same conclusion: was it's a lot of work if you're still, at the end of the day, going to reward your underperforming employees the same as you're going to reward your overperforming employees. So they all felt like it was a very good way to put everything onto paper and to be able to exercise the need of, you know, how to boost your work ethic or your professionalism or your performance, but at the same time there's no reward, is what I heard back from department heads. So
That was the historical case here, is all we did, started doing this and then stopped doing it because it was a lot of work and there was nothing gained by doing it really. I mean, well, there's some gains, but we're talking about money is what everybody's talking about, so.
And DSS and the health department, they still evaluate each employee annually. They're not required, well, DSS is not required to by the state. The health department does it so that they can remain accredited health department with the state.
The DSS and the health department are doing it currently.
Because they're required by the state.
Okay, got anything else before we start? Commissioner Mendenhall, you have questions, comments?
No, I'm good.
What do you think, Brandon?
Just a comment with the, and I get that about, too much work, performance evaluation. And I never really liked doing performance evaluations either. But that's abnormal. Have an organization does not do some type of performance evaluations. I know personally, I think we would try, we should try to give some type of merit-based incentive to do that. But even if it would be on some years, maybe due to some kind of unforeseen budget matter to where maybe we could not give a merit increase for that year, that the performance evaluation should still be done, because what it does, it forces, because some department heads, especially the larger employees, it's very easy not to have contact with your employees and ask, shall we say, tough questions about, how things going. And then when you do have conversations or you don't have conversations later on, when a disciplinary matter comes up, then you have this, you never told me that. So I disagree with I get it, I don't, that's just part of their job. And if they don't like being a supervisor or be a department head, and there's probably other roles in the county government that they could perform. That's all I got.
Hey, Commissioner Wood.
Personally, I've hated them for 50 years, but they're a necessary evil. I've had some that was very detailed and helped me get promoted. I've had others here sign this and send it back to me. So it depends on the department head, but I think it's a good idea.
I think it's a good idea as well, and I think it's necessary because of the documentation that you were talking about. And the merit increases would be great if we can afford to do that on a yearly basis. And I think we would have to look at during budget time at how it would affect the budget, what we could afford to do. And it might be, some years it might be better than others. But, I get what they're saying, that, it's a lot of work if everybody gets, if nobody gets a reward for it. But also I think anybody in a supervisory role or department head should, for the health of the organization, see the need to do it and document. So I'm in favor of doing it.
Okay, I am too as well in favor of doing it. I think this form is pretty comprehensive and will meet the requirements. I would like to do the policy, to go ahead and do a policy that includes merit pay. The merit pay piece of it would probably be separate anyway, but if the policy already approves that, then when you do the merit pay, the two would fit together. So, and I would like to really like to look at some kind of merit pay program as quick as we can. This, on this form, if you're in the always exceeds requirements, which is the best block check you can get, and then the next one below that, promote ahead of your contemporaries, and then it's got an area where you can comment on the person's potential, and if you get a good write-up there, then you're in a very small percentage of the organization, I would say. You're in the top performing part of the organization, and you should definitely be recognized with additional pay, in my opinion, for doing that. How you spread it for the next two categories down, would have to discuss, but probably something should occur there too. One piece, there was another form that actually I drew up whenever I was county manager, where you list the expectations and then you fill in the expectations. You got that one right?
Was it the one that was attached to the meeting before this?
Yeah, it was like, yeah. I'd like to see that too, because one thing that does, it forces the communication at the beginning of the pay period, of the evaluation period. forces you to have a conversation on what's expected. Then it provides for the employee to feed back to you how they accomplish that at the end of the pay period. And then it makes it really, when you have that form completed, it makes it really easy to do this evaluation for the person who has to fill out the evaluation. Because they've already got it all written down pretty much. So if you would, I'd like to at least bring that back and let everybody look at it next time to see if we want to do that.
I think it's something we need to do, but we need to get it right. So take our time and get it right.
Yeah.
For sure.
So, good job, Jamie, on both of those topics.
Thank you.
Yes.
And what's next?
Moving that to the next meeting for action?
No, I don't think.
No, there's no way we can get.
Discussion
action on
maybe next time?
Yeah.
Back on discussion.
Yeah.
Do you all just want to like review a policy then, or, because we probably won't start talking about anything with merit pay anytime soon.
Not until the budget
Just
cycle,
the
I would say.
evaluation policy and forms.
Yeah.
Okay, the next thing is the offer to purchase residential structure, I think, Linda. Offer to purchase residential structure.
This is a little unusual one because we usually don't have people wanting to purchase things you really don't have out there, but we do with this one. Stewart was contacted by Mr. Flincham several months ago. I think it was kind of about the time where the discussion had come up about the demo of the prison camp and the residential structure that's beyond it. And in that discussion, he had inquired what if he wanted to purchase it, just the residential structure. So I gathered all the information, let him know kind of what the procedures would be, and haven't heard anything until this past Wednesday. And he came in, he sent his wife over with an actual offer to purchase just the residential structure. Because I explained to him the property's not for sale or anything, it's just we're going to tear it down, so he would like to purchase it. So in the general statutes, we would be deeming it surplus because it will be tore down if we keep it, because it's not the best structure, but he feels that it's valuable to him, I guess. So he has made an offer of $2,222, and he has put down the 5% bid bonds and everything that is required. And so I'm bringing it to you all to see if you would like to accept his offer, and if you would, then there's a resolution that we just need to approve to start the upset bid process, which requires it to run in the newspaper for 10 days. If someone bids against him, then the 10 days starts over until the bid stops. So that's where we are with this. I told him I would bring it before you all to see if you all would like to proceed with accepting his offer and going from there.
Is he planning to move it?
Yeah, that's my question.
Yeah, is he gonna move it?
He'll have to if he purchases it. Yes.
He's not gonna like dismantle it on site, is he? I mean.
I guess from our standpoint, if it's gone, it's gone. But I would see no way that he could dismantle it on the property because it is a structure, residential structure that was built by the tax records and everything in 1955. It is on a basement. Shannon and I actually went over the other day when we had some other errands to run. Some of the doors are missing. I made sure, I'm like, you have looked at this structure, and they're telling me they have, and they want to place this bid.
Haven't we placed a new roof? Is there on any part of that building?
This is a
House.
separate piece of property. It's the house that's right beside where the Friends of Stokes shelter is.
Okay.
Past that, that was purchased by the county to just try to get that piece that was adjacent there when that house came up.
Right after in between the Stokes Friends and the early college.
Yes, correct. Yes, it's the little white house. Still has the address there, 1125. It's kind of right on the road. It was a private dwelling. Yeah. Yes. And someone's come in and removed the cabinets. I hadn't seen the structure except just driving by it. I'm thinking they were removed prior to us purchasing it. So like, there's no cabinets, there's no doors really on the one side. I was a little leery to go on in because all the windows are up, and I'm like, I don't know what else is in here. So I just kind of went from the door and kind of looked, but
I have to be honest, I'd want to go look at,
yes.
I'm sorry, I just have not ever really gone in and looked at
And I
that
took some
building.
pictures if anybody wants to look at them. I did take some pictures from the outside and everything.
Got
So,
it with you?
Yeah.
Yeah.
I just kind of
That's
did
about
some quick stuff just to, this is kind of where it's located. The Friends of Stokes building is here, and then this is the property there, but y'all are welcome to pass them down and around. I just kind of did what I could from the outside.
Yeah, I'm familiar with it, so why don't you guys all look at it right quick?
I'm sure.
It's getting snake season, you know.
Oh, yeah. I wasn't real sure where the doors were off of it. I wasn't real sure what else was in there other than me, so I'm like,
He might restore.
So is it his intention then to put it on the whole house in one piece on a truck and haul it away, or take it apart? Do you
My
think?
understanding, his intention is to actually up and move it. Now, I haven't got into details of what his plan is to do, and I'll be glad to reach back out to him and see if he wants to provide me any other information. I kind of wanted to come to you all before I did anything, so.
I was gonna say, I mean, now we need to think this thing through, because if he purchases it, it becomes his, correct?
Right.
And we could not, unless, how could we enforce him to move it unless we put it in the contract?
Right, and on the resolution, I put in there, he would, the buyer, if it happens not to be him, if you put it out there, it could be someone else. But the buyer would have to sign a, liability statement. My opinion, we would put some type of disclosure saying you have 90 days, 180 days, whatever that may be, to move it from the property. I think we would have to do some conditions. Stuart had mentioned it to Ty when they had a meeting kind of after we received this, and he agreed that, yes, we would definitely want to draw up a, kind of simple contract to state this is your provisions to purchase it.
Which would hold the county harmless of any liability.
Yes, yes,
I just give him a liberal time to do it.
yes.
If he don't, his money is ours.
Right. And that's what I said, me and Stuart talked about it earlier today. You kind of have to put a time frame, because if not, you have no grounds to, well, when are you going to move it? Well, I'm going to move it tomorrow. Tomorrow never comes.
We'll give him a discount on other buildings over there.
So we
I want to get one free.
Board want to put it on action for the next meeting then?
That's fine.
Give you time to look at it and everything.
Yeah, y'all are welcome. If you want me to meet you over there, I'll be glad to. Y'all just give me a holler. It's pretty open. It's there. So you're more than welcome. And I will reach out to Mr. Flincham and see if he can give me some details of what his exact plan is.
That would be helpful.
Yeah, you don't have to go behind
Heard of
any
me,
fence
yeah,
to
yeah.
get to it.
No, you actually just pull right in the driveway. Right when you pass the Friends of Stokes, it's the next driveway on the left.
Okay.
Okay.
Well, once I saw the picture,
Yeah,
I recognized the building.
Yeah,
I thought you all may when you seen it.
I'd say put it on action next time.
All right.
Yeah. Thank you.
Thanks, Linda. Okay, the next item is a resolution requesting room occupancy and tourism development tax. And Tori's here and Shannon.
Lost Eddie.
Yeah, Eddie had to go to a meeting, but we're good. Tori can take care of this, no problem.
Thank you for letting us be here today. And I know, Rick, that you are interested in getting a resolution together in the board for this collection of room and occupancy tax and tourism development tax. So Stokes County is one of 9 counties in the state that does not collect any form of occupancy tax in the county level or municipality level. There are some counties who don't collect it at the county level but do collect it at the municipality level. And most of these occupancy taxes were put in place in the late 80s and early 90s. And when you do go about this, we're basically agreeing that the county is interested in levying this tax, and then they will bring it into the short session or whatever session they're in Raleigh to put together a legislation and bill for the county to collect this, and it will have all the legalities in there about creating a TDA to, which is a organization that has representation from different players in the tourism realm and the towns and the municipalities, and even appointed from county commission if needed. But this is just something that I feel like since 2020, the number of vacation rentals in the county have doubled. We have about 80 different rooms that are available or houses. And just 2 weeks ago, Wilkes County was able to get occupancy tax put in place or agreed upon from their commissioners to go to the state level. And they haven't been collecting anything other than Wilkesboro. And their local politicians and folks have batted that around for 15 years, but they're finally getting something together. And I know that we've talked about occupancy tax since 2018, 19, and Richard and I have sat down and talked about many options, and we've updated maps that the mapping office has of all of the accommodations, their addresses. Of course, we would want to contact and send letters to those folks to let them know that this was going to be in place, and there are opportunities for public hearings once the bill gets put in place by the state. Richard has estimates that we could get upwards of almost $100,000 out of this if we collected at a 6% rate. And most of the vacation rentals that have been renting since 2020, they're booked 20 to 21 days a month, where prior to 2020, it was mostly weekend visitation. And there's definitely a trend of people who are visiting areas to stay at vacation rentals over hotels or motels. So I'm happy to take any questions, and Amber's been working with this as well.
It would also include hotels, right? Like, so
Yes,
in the
yes, it does
future,
include hotels.
if we attracted, some kind of lodge or hotel, it's automatically covered, right?
Yep, that's correct. And it would include the motel that we have in King. Caswell County, they're collecting occupancy tax, and most of their occupancy tax, they get $15,000 in Caswell County, but they don't have as many vacation rentals, but they do have a 2 to 3 star hotel that they're getting that money off of in Caswell County.
Okay, Ron, you have questions?
I mean, I'll start this. This is another one of those that we sort of, Sonia and Rick and I, on the last board have batted around for, like Tori said, 2 or 3 years. And, did you say only 9 counties
Yes, only 9.
in the whole state does not?
9 counties, so there are 9 counties without a county or municipality collecting any form of occupancy tax.
Only 9.
Yeah.
And we've talked about this, and I'm going to tell you, Stokes County is growing leaps and bounds, as he said, with bed and baths and people coming up in the summertime wanting to stay, with Hanging Rock Park, maybe staying in a bed and bath or I think it's time we make a move on it personally. And so I looked over the occupancy tax, and it says 6%. It's got to be approved by the state. And I think Rick has been in contact maybe with someone from the state. So I think it's time to move forward with it. So, Mr. Chairman, that's my position.
Okay, great. Do you have anything to add, Brad?
Just that I think it's time that we do move forward with it.
Pass time. I'm all for it.
Okay, Sonia?
I had a couple questions about this. Can you tell us a little bit about how it's collected and what can, if anything, is done if somebody refuses to pay it? Like, say, for instance, people who have Airbnbs or VRBOs, and I know people who actually, it's their house they live in, but they go stay somewhere else and rent their house for a week. And then a lot of people do that when the furniture market's in High Point. It's pretty common. They have, places to go, and they like, well, I'm going to rent my house for the week. And maybe they don't do it often. And I mean, I'm not really trying to catch people that maybe it's just an occasional thing like that they do, but what if anything, where's the teeth in it that you can actually collect the money, and what happens if somebody don't report or turn in the money? Or have we just even considered that yet? Like,
Well, so this is a resolution to show that the county is supporting this, and then they will form a state bill that will go to put the occupancy in place, and that bill will outline
that might be a
the
Richard
number
question.
of people who are in the TDA. It also outlines what happens, like in Rockingham County, they have if they don't file their occupancy tax, they get a $10 per day charge for omission of not submitting it quarterly or whatever the stipulations are for collecting. And then there are additional taxes that might be charged upon that. But now, if you're talking about most vacation rental by owner on the vrbo.com site are people who own houses and they don't live there. These are houses that they use for vacation rental only. And they may come and stay a week out of a year because, like at the retreat at Hanging Rock, you've got a family that owns a house there and they live in Florida primarily, but they have somebody local that manages all their bookings. And a good thing too is that VRBO and Airbnb, if your county has this legislation in place, they submit the occupancy tax rate to the county directly. So the person that's renting the house has no real bookkeeping that they have to do. They're not the ones.
No, they don't. But I'm saying the people who own the property, if I have a rental property and it's an Airbnb, and I mean, I think you answered it. There's a fee they would have to, a per day fee they could be charged if they're not reporting and paying the tax.
Correct, yeah, and it would be formed in the bill and
Okay.
outlined, and I'm sure we'll have to go through
gotcha.
public hearings and other discussions on all of that.
So as far as the hotel that's in King and the potential of other hotels that would come to King, what if the city of King wanted to collect? Can they collect an additional tax? Like I know there's, like at the beach, for instance, Horry County might have one, and then the city of North Myrtle Beach may have one. So they can do that.
Yeah, so Rockingham County, they had their legislation put in place in 1991, and then in 2006, they did some interlocal agreements with the City of Eden and City of Reedsville. I've been in contact with Magellan Strategies, Chris Kavanaugh, and he was talking about some of the earlier counties and towns to adapt, like Surrey County, their municipalities were the first to put in an occupancy tax. And then the county put one in place in 2009. But most counties would prefer for there to be a TDA at the county level, and then you have representation from the cities like King, Wantagh, and Danbury. And I've spoken with Kim Greenwood and Mike Barsness. I wasn't able to get in touch with anybody at King, but we will definitely talk with them. And so if King you can't collect more than 6%. That's the max you can collect. So if the county collected a smaller portion and then the city of King wanted to put something in place, say county would do 3%, King would do 3%, that'd be the 6%. But there can be interlocal agreements to part out some of the money collected at the county level to
So they don't have to worry
the
about
chamber
that.
or something like that. Yes.
Well, I think technically they could collect over 6%, but it'd have to come through legislation to allow that special exception. Like Mecklenburg and Charlotte, they have a special exception, like more than 6%.
And
Okay.
which county was it that they put a portion of their occupancy towards economic development incentives? Caldwell, yeah.
Okay.
So it's all in how you write it into the
Okay.
legislation.
That answers my question.
Okay,
Sorry.
I think it's kind of a no-brainer to do it. Eddie definitely strongly supports it also. I think people expect to pay it. I mean, they're not surprised. It just gets passed from the vendor down to the customer. So I like the idea of the TDA at the county level where we involve the municipalities and let them have a say-so in how it gets used. I think if we do that, then that should satisfy everybody about how we go about collecting it. I talked to Kyle last week at a luncheon about it, and I sent an email to Senator Krovic today, which I copied everybody on here, I think, on the board. And I think I copied Eddie on that too. Giving her a heads up that we want to do it. And Kyle's comment was, we'll get it down here as quick as possible because they're working on the budget. So we probably, if we're in favor, we ought to look at maybe moving it to action today, just so we give those legislators the maximum amount of time to get it in the budget for us.
And that's probably why Wilkes County has moved fast with theirs as well.
Yeah. But, yeah, it's definitely something we need to do. I mean, we pay this everywhere we go, so they ought to have to pay it when they come here.
I mean, this is not
Yeah.
really 99%. It's not coming from Stokes County residents. It's coming from people outside of Stokes County
Yeah.
coming in here for a week, and we're gathering that money. That's the
Yeah.
big positive in it.
Mhm.
I just don't see a negative really at this
Yeah, I agree. So you guys good with putting it on action, the resolution? Is that all we need to do is do that and send it to those two legislators, right?
We did send out a little survey before 2020, and some of the concern was from the larger vacation rental owners was what do I get out of it? But they would have potential to be a member of a TDA and be able to put input into how we advertise and spend that money.
Yeah, it's not just government on the TDA, right? It's private and government. Yeah, all the stakeholders can be on that.
Correct.
Yeah. Okay, good. We'll put that on action then for
Thank you.
today. Oh man, this is where we're going. Interim. Oh, the interim county manager proposed contract. We have a contract in the package today for to make Amber the interim county manager. I don't have anything to really add to that. You guys have read it unless you have comments or questions or want to make any changes to it. Then I guess we need to decide if it needs to go to action today or next time.
When's our next meeting, Amber? March what?
Is your next meeting?
You want to start, Commissioner Cox? You have any comments or questions on the
I don't really
Contract.
have any comments or questions.
any action today or next time?
Yeah, I think being that the next meeting's the 13th, it probably does need to be on action today.
Okay.
I agree.
Commissioner Wood, Commissioner Chandler, you good? Commissioner Mendenhall? I'm good with it. Okay, so put it on action, Amber. Is that it for discussion? I think it is.
Hallelujah. Sorry.
Come up with this agenda.
We didn't look at bad when we started.
Amber came up with it. and I
Never tried to
approved it.
estimate how long one's going to
Okay,
Can roll through the action though, I think.
first item on the action agenda is donation to Stokes County Historical Society.
Make a motion to approve.
Second.
Is that one got
That's the
a,
benches.
does that one have the one that has another resolution with it? I had one question on the resolution, if you'll let me get to it right quick. Just a second here. Linda, it has one sentence on it that I wasn't sure. I didn't exactly understand. It says, it's the first whereas. Have you got it in front of you?
I do.
Where it says, whereas North Carolina General Statute wants to authorize the county to, and then it stops. Is it supposed to say to do something right there, or is it?
Maybe I attached the wrong one. On the first sentence?
Yeah, on the first
right
one,
here.
where, first whereas, it's,
Paragraph, where it stops right here, where it says, whereas North Carolina. Oh, I'm sorry. I mean, it just stops here.
Yes, we just need to delete that one because this one the next line down is really what should be.
just take out that first
Yes,
whereas.
yes.
Okay,
Take out the first whereas.
okay.
Yeah.
My motion is we approve it with taking out the first whereas.
And I'll go do that now and bring it back to Amber for you to sign.
Okay, have a second?
Second.
Any further discussion?
There is discussion.
Yeah, go ahead, Ronnie.
And it is not, we said the first whereas. Actually, the first whereas is the first word.
It's the one right after the paragraph.
Exactly,
paragraph, yeah.
but whereas is first word of the first paragraph.
That'd be your second.
So we said the first whereas.
You're removing the
If
second.
you say the first whereas, you're actually saying the first whereas in
Right.
the first paragraph.
Correct. It'd be the second one.
It's the first whereas bullet and the second one.
I guess that's where I'm.
Yeah, that's what she's taking out.
Just gonna
right?
remove the line that
We
says
do so
whereas
many things.
168-2 Oklahoma County 2. You're just removing that line.
Okay. We got a motion and a second.
Any further discussion? Okay, all in favor say aye.
Aye.
Opposed, no. Motion passes. Stokes County Water and Sewer Authority appointment request. We have Wayne Smart and Joe Turpin nominated to fill that vacancy. I'd open the floor for further nominations.
We already did that, didn't we?
We closed them at the last meeting, and we said we'd vote on one of the two.
Oh, did we?
Poll one of the two.
Okay. Well, we can poll then. Starting with you.
Thanks, sir. Smart.
Turpin.
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 Okay, so Turpin then will be the next person. Both these guys are good guys that are qualified to serve on that board, and I would certainly recommend we consider Wayne Smart again if another opening comes up. Okay, the next one is the Poplar Springs Land Lottery Lease Period. Have a motion?
I make a motion, we approve.
Second.
Any discussion?
No, sir.
All in favor say aye.
Aye.
Opposed? A motion passes. Then the last thing, not the last one, but the last one on my paper here is resolution recognizing farmer appreciation, which is going to crank back up this year, so we get a motion to approve that.
Motion to approve.
Second.
Any discussion? All in favor say aye.
Aye.
Opposed, no. A motion passes unanimously. Hey, Amber, what's the next two?
Item is the additional animal control staffing with the new animal control officer and a new dispatcher/office clerk. And that comes with the new job description at pay grade 29.
And a budget amendment to follow.
You have to do one to follow it the
Next meeting.
So that, we go higher what those amounts will be.
Okay.
All those things added, so.
Okay.
At a later meeting.
Okay, so get a motion to do the animal control addition of 2 positions.
I make a motion to approve the 2 new animal control positions and animal control officer and dispatcher/clerk.
And that's a new job description, so you're.
And the new job description.
Along with the new job
Yeah,
description.
Yeah, along with the new job description.
Okay, second.
Second.
All in favor, any discussion before we go forward? Okay, all in favor say aye.
Aye.
Opposed, no, motion passes. What's the next one, Amber?
The resolution requesting the occupancy tax.
Yeah, resolution for the occupancy tax, so we can get that down to our legislators ASAP.
Motion, we approve the resolution on the occupancy tax.
Just a second.
Second.
Any discussion? All in favor say aye.
Aye.
Opposed, no, motion passes. Is that everything? Oh, yeah, we don't forget that, do we? The approval of the contract, motion to approve the contract for interim county manager.
I'll make a motion to approve the interim contract for no more than 1 year for interim county manager.
Second.
Second.
Any discussion? All in favor say aye. Aye. Opposed, no. Passes unanimously.
I make a motion, we go into closed. She's gonna read the rationale.
I think you're in a hurry, aren't you, Ms. Cox?
People got work to do.
To prevent the disclosure of information that is privileged or confidential pursuant to the law of the state or the United States, or not considered a public record within the meaning of Chapter 132 of the General Statutes, and to consider the initial employment or appointment of an individual to any office or position other than a vacancy in the Board of County Commissioners or any other public body, or to consider the qualifications, competence, performance, character, and fitness of any public officer or employee other than a member of the Board of Commissioners or of some other public body pursuant to General Statute 143-318.11A6.
Okay, all in favor say aye.
Aye.
Opposed, no? Okay, we're in closed session.
I did.
Lane seconded it.
Got just enough time to make 6 o'clock.
Thank you all.
Hey, thank y'all.
Thank you
Don't
very
get behind
much.
the highway patrolman.
Hanson.
Yeah, on Mountain Road.
Editor staff.
We open session now? Okay, we're back in open session. The motion to adjourn.
Motion adjourned.
Second.
All in favor, say aye. Aye. Opposed?